Okay, let's go to the measles outbreak now. We've been talking about it a lot. It has grown. It's mostly out in West Texas, so for the moment, that's good news for us locally. Latest count from state health officials today, 198 cases. That's across 9 different counties, and that is since late January. They say this highly contagious virus continues to spread, and it's still mostly to unvaccinated children, that population out west. One Texas child has died as a result, and then a man with measles nearby in Lee County, which is technically New Mexico across the border, has also died as a result. So as of right now, there is a fair amount of urgency among the local healthcare community here to at least be prepared, be ahead of this thing. Dallas County urging anybody who suspects they've been even exposed, call your doctor. Don't show up at an office or a hospital ER because you risk infecting others. All of this as some doctors fear that it is not a question of if there might be more measles cases, but a matter of when. Our Robbie Owens now to share some of those details.
Medical experts say it will take 3 weeks with no new infections to begin to relax about the threat of another measles outbreak. Until then, they're working to be ready.
We can deploy a mobile strike team pretty much at a moment's notice. We have the supplies. We have the trailer ready to go.
Dr. Brian Bird is the director of Tarrant County Public Health.
And for example, Robbie, let's say there was an outbreak that was related to a certain school or a certain daycare center. We would set up that mobile unit in that parking lot or very close to it, where we could vaccinate people who may have been exposed.
Dr. Bird says Tarrant County has a 90 to 97% overall measles vaccination rate.
And they're not allowing government or science projects to affect how you live.
Even as the pastor of Fort Worth's Mercy Culture Church has gone on social media celebrating that a school associated with the church has one of the lowest measles vaccination rates in the state. The church has declined comment, so we asked Dr. Bird about his level of concern.
We're going to focus on treating the people who need us, and we'll leave it at that.
Meanwhile, Cook Children's in Fort Worth shared this video explaining how they've already set up a 6-bed infectious diseases unit, all negative pressure rooms to ensure that the world's most contagious virus doesn't escape through the vents.
This is for our employees, this is for patients and parents and families to begin again to make plans in case this becomes an outbreak.
And so please, please, please do not treat this like the chickenpox. Do not treat this like a cold. This is a serious disease.
Robbie Owens, CBS News, Texas.